Welcome to the Holistic Health Show, where the worlds of science and spirituality converge to illuminate a path towards total well-being. Join us as we embark on a journey to bridge the gap between Western medicine and complementary therapies. Hello, everyone. Welcome back to the Holistic Health Show. We have another exciting episode for you. Today, we are going to discuss the topic of the importance of giving yourself, your body, the time and ability to heal. So we're going to hear a little bit about that. Dr. DePontes, I'd love for you to jump right in and share with us how it is you got into homeopathy and functional medicine.
I'm a real people's person. It's going to kill me if I have to sit behind a desk and measure out amounts and quantities and so it's like no ways. And it just happened to be that there was a course on natural medicine, homeopathy going down in Durban. And, as they say, the rest was history. 5 years later, then I started the journey of consulting with patients and it just grew from there. And as you know, natural health techniques have just been increasing in people's minds and in their lives. So it's been good.
And it's quite remarkable, isn't it? Because, in some sense, a lot of people will think, oh, this is very new. It's a new way to approach our health. But it's actually quite traditional, quite old, and it goes back. If we look at the history, and it seems like it's just kind of, re-emerging, which is really exciting.
That is true. But that's just because that's the way modern medicine has put everything. You are bombarded with modern medicine, conventional medicine way of doing things. And so that's the status quo. I'm born into this world and I'm exposed to that, and that's the norm. That must be the perfect way to do it. So then what I find is that's the route that people go until they lose their health, they get disease in some way, and their regular approach isn't working. And some people then look to other options, natural medicine. And then they start, there's a bit of time, can't really work, but hey, I don't have any other options. So let me give it a try, not putting too much faith into it. And if they go down the right path, they are most of the time pleasantly surprised, and it does work.
And it's unfortunate. I mean, it's great that, as you said, everyone who is not finding the Western system kind of getting to the root cause or healing their symptoms or giving them the help they need. But it's disappointing that it's the last resort, that it's until the Western medical model has failed them or has said, well, you got these symptoms, but we don't actually know what's wrong with you, that people go, okay, well, I know I'm not well. I have to find something. So, okay, I'll give natural medicine a try. And wouldn't it be lovely if that was not the last resort, but rather maybe integrated with the Western system or just more accessible,
If I look back 20 years and I look now, it definitely is going more that way, especially with the pandemic that happened. My practice took off tremendously. People were like, they were looking back at this conventional medicine and they look forward then to natural or other approaches because it was a bit suspect what was happening. So I think people are all waking up to a degree. That being said, often they'll say, oh no, this is a very serious disease. No, they must look at conventional medicine. They are under the impression that no, it's very scientific and it's very proven. And I've seen that often with research, you can prove whatever you want. So I don't see it fully scientific like they have proposed it to be.
Yeah, I would agree with that. And I wonder if we can kind of jump here. I just want to start getting into, so you're a homeopath and a functional medicine practitioner. What is a homeopath and what do they do? Kind of delve into
Right.
that, and then we can
Yes.
approach the functional medicine practitioner.
Right. So the reason why I added in the functional medicine practitioner, because at that time, homeopathy didn't have a vibe with the public and it wasn't very well known. It didn't have reputability. But, you talk about functional medicine, it's more in line with conventional medicine. So more people would kind of lean towards it. But yeah, homeopathy is about 200 years old and it's based on natural laws and natural principles. It was started by actually a medical doctor, Samuel Hahnemann. And I think because of the way things were going there and the politics involved, it was poo-pooed. But, it's based on natural laws. So that means those laws are solid and those laws stay there irrespective of whether the politics changes whether the prices of anything goes up or down. You can't patent it. So it's very accessible, but that's not the status quo of today. Also, if you look at it from the perspective of how things are put out there, it isn't put out with the biggest or the highest esteem. And I see that as purely political, what do they call it? Medical, legal, political aspects at play there. All right. So that's also another reason why people are not so familiar with it. If I get back to these natural laws, they work. They work because it's nature. You can't say or change something just because you think that's not going to suit you. Nature works on natural laws, and our bodies are biological. We are biological beings, and they function according to natural laws. So it is brilliant, and you are having to follow those, and you're almost guaranteed of the result. Now, when you look at conventional medicine, it doesn't do that. Conventional medicine is very powerful, it pushes and it forces a result. For example, we've got an infection there, we're going to give an antibiotic, which is so strong it can have so many side effects, but at least the infection there will be resolved. Or should I say resolved for a while. That's why you sometimes have a reoccurrence of problems. Now, it doesn't happen like that with homeopathy. And if we get back to these laws, I want to start by talking about us and our bodies. You know, you sitting there, you're looking at me, you see this male physical body sitting here, but I'm not just a physical body. Okay? I've got an emotional body. I get happy. I get sad. I get angry. I've got a mental body. I can think. I've got consciousness. Then there's a spiritual body, and you can go into all of these aspects. And when you look from a homeopathic perspective, it's more holistic medicine. You're looking at all of these bodies and how they interact with each other. But now, as you know, everything today is instant gratification. It's rush, 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 go, 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 right? And you are not so familiar or in tune with your emotions. So a lot of the emotions are trapped or blocked. And when we look at the stresses and pressures at work, you may be like to say something. Or even if I take it back to in your family and the hurts and the traumas that occurred, well, you're not allowed to say exactly how you feel, or maybe you feel too hurt to say something, too disappointed, or too angry. Well, you just, suck it up, keep it in. And that's how we are measured, how we are taught to survive. That's how we are surviving. So now we close that off. So our emotional bodies are operating at a very low frequency, a very low level. Right? Now, you must know, I'm going to be a bit dramatic here now, Amy. Okay.
Go ahead.
Let's say you're thinking in your head, wow, this guy's very expressive and enthusiastic. Okay. So how do I get that? How do I get to be like that? Okay. It's not just my physical body and I am doing things like this and I am so bored. It's not like that. The combination, my emotional body is charged up and able to interact with my physical body. It comes out in my whole being. So someone would look at that and say, wow, that guy's on fire, or wow, he's so knowledgeable, or whatever they pick up. When you see so many people walking around today, they're all overworked, underpaid, and the list can go on. So when you're going to look at them physically, they're going to be shells of people. But that is, you can see he's over, you can see all those things, but they're not able to put it together and say why, right? Because he's not able to express his emotions. Okay. He has to keep quiet. He has to go and work that 18-hour job or that 15-hour job and just say, yes, sir. And he's not able to express himself. So this all leads to disease. Now, your body is a self-regulating organism. It's trying to sort it out. It's trying to fix it up. So I'm actually a specialist in thyroid disease or in autoimmune conditions. And I see this every day in most of my patients. So you see this woman that comes in and they always will manifest themselves as, yes, I've come because I've got Hashimoto's or hypothyroidism. And so, you look at the regular hypothyroid symptoms and maybe the point to kick off would be, okay, we're going to start with the traditional treatments. Oh, your thyroid hormones are down. That's all very good and very scientific, et cetera, et cetera. But the treatment doesn't work. Okay. Even when you get their labs into the normal range, the doctor would say to you, listen, Amy, you're doing great. You know, your labs are fine. You should be feeling fine. And Amy might be saying, but I don't. I'm still depressed, or I'm still tired, or whatever it is like that. So like 1+1's not making 2. But then they will start to say, you know, there must be something wrong with you because, you know, the labs will say. So in homeopathy, I said we're looking more holistically speaking. Okay? The whole person. It's not just a lab. It's not just a 2D something on a piece of paper, right? So, okay, there's this patient with those labs that are okay or not okay. But how are they feeling? What does everybody talk to do today, Amy? Amy, how are you? No, I'm fine, thank you. And you? It's like an inbuilt response. You don't actually think about time to feel about it. Or you say, well, you know, I can't let him into my private space. I'm just going to say, I'm fine. And that goes to obviously at work, and even go as far as when you're at home and even in your family, you are shocked or you're traumatized by some events that have happened at home. Specifically talking here, if I'm talking about my thyroid patients, there's a lot of sexual abuse, emotional abuse that can happen from when they are children, up even into the marriage. So how would this biological body respond to that? It numbs itself off as a response to survive. Okay. It's in a survival mechanism. When you're in the survival mechanism, all your stress hormones are up, your cortisol, all of these things, but you are not in a joyful state. All the inflammation and your hormonal aspects reduce, and you are manifesting in this physical body with this hypothyroidism. Let's get back to the homeopathy. How do we diagnose, or how do we look at the patient and see what is happening? How do we look and see what medications do we have to give? How are we going to help this person? And it all goes on the symptoms. How is the patient presenting? So you would still look and see, let's take an example, they're constipated. Now, if you look at it from a conventional perspective, constipation, let's give a stool softener. In homeopathy, you will not specifically give the same medication to two people with constipation. How do they manifest with that constipation? The one says they've got a hard stool and they're very gassy. The other one will say, it's a hard stool, it just doesn't want to come out. They've got no gas. So we look for the remedy, the homeopathic medication. Now, a good way to explain it to you would be like this. I say to you, Amy, do me a favor, take this onion and go and cut it on your kitchen table. What happens to you?
When I cut the onion, my eyes would water.
That's it. Your eyes would water, maybe your nose would run a bit. I say, thank you, Amy.
Yeah.
Give me that onion back. I'm going to make it into a homeopathic format because tomorrow I've got a patient come to see me and they have got hay fever. So now what is hay fever? What are the symptoms of hay fever? They get runny eyes, itchy eyes, maybe their nose runs. Can you see the similarity there? And these are the natural laws. So we say the drug or the remedy, that symptoms that it produces are the same symptoms that it cures. You cut the onion, you get the runny eyes. You're going to give that in a homeopathic format to someone who's got runny eyes. So now we can extrapolate that, and it doesn't just have to be over runny eyes. Someone comes and they've got a hypothyroidism. Now, look here, we can give it on the fact that maybe they're putting on weight, or we can give it on the fact that they've got no energy. Okay, so we're looking for a remedy that is the same like that. But now let's take it one step further. And this is the beauty, if you can get it right and if you can understand the remedy. Remember, I said to you that the emotional aspect of the body is where the body, an emotional body, is more important than a physical body. If I explain to you like this, I always say to our patients, all right, so I've got some bad news for you. You've got to tell me, what would you prefer? Would you prefer to be depressed your whole life or have maybe a bit of eczema on your baby finger? How would you respond?
Well, I would definitely not want to be depressed my whole life.
Right. So this is something that's called Herring's law of cure. It's a hierarchy of how we see how severe is the illness. So now you just said, I don't want to be depressed. I'd rather have eczema on my baby finger. So what is the eczema on the baby finger? It's a physical condition. So you've just shown me that an emotional condition is more severe than a physical condition. All right.
Yeah.
So there we are jumping between the different bodies. And if you're going to look at someone, You're going to say that person is more sick because they've got emotional disease. That person is not so bad. It's on the physical level. So every time you're looking at someone, this is what you try to see. Now, they might come for a hypothyroid case and they've given treatment and it's not working. It's not resolving the problem. You say, I've done everything. I've done the tests, and this is often what happens. But they can run with this disease for 20 years. Little improvements, then it reverses back because they haven't got to the heart of the issue. And the heart of the issue is in the emotional body. We're talking about being able to ascertain where is the block, so to speak, and then to be able to release that block. You've got to find the homeopathic remedy where the block is in the emotional body. All right. Now, the higher the potency of the remedy, the more effective it is working on the emotion. Look and say, well, what if it's conventional medicine? Conventional medicine also works on the emotional body, right? Yes, I'm depressed, so I'm just going to take an antidepressant. And, it should work as well. Yes, it might make a few changes there, changing the levels of the serotonin, etc. But here's the thing. It's what we call palliative treatment, okay? When they stop giving the SSRI, the serotonin's going to go down, and the person's going to be depressed again. You have not solved the problem. It's a palliation. So let me go back a bit. You've got Hering's law of cure. Dr. Constantine Hering in the 1800s, he was looking at how the body heals, and he said the body heals from above down. So, if you've got a condition on your face and that condition moves from your face and it moves down, say, to your legs, that is a very positive effect. It's moving from above down. It moves from a more important organ to a less important organ. You've got the inflammation of your brain, and that inflammation of the brain goes away, and then you get, say, inflammation or eczema on your skin. Okay. So this is that example that I was trying to give you. Would you have inflammation of the brain, or would you have some inflammation in your skin? You choose your skin because it's not as important organ as your brain. Okay. And then I gave you the example of going into the emotions or just staying in the physical, and you chose the physical. So you know what's happening there. But the difficulty is to move the focus of the disease from a more important organ to a less important organ, or from the emotional body into the physical body. And that's how we look with homeopathy, using these laws to see, are you healing or are you not healing? And this is what people don't really understand. Oh, I've got some eczema and I've taken some cortisone cream. And it's wonderful. The itch has stopped and I've got no eczema left. But, a month or two later, I start developing asthma. If we just look at it this way, what is happening? It's moving from the skin into the lungs, right? The lungs are a more important organ than the skin. So it's moving the wrong way. So you are not healing, you're actually suppressing the illness. And that suppressive condition then reduces the vitality in the body. So after I've had that done, maybe I'm not so energetic. Maybe I'm a bit depressed. Maybe I have problems sleeping. I don't link the two. I don't link the fact that because of the suppression, that this is why this is happening. And then you get patients saying, well, I don't know what's happening. I know I'm 50 or 60 years old. It was just the old age, Amy. That's why I think I'm like this. So this is how they are rationalizing their illness. Okay. And it's not that. It's because the way they were treated, they have been suppressed or the disease has palliated. The person's expectations for their health is very low. And that has been put like that from the medical profession. I say to you, Amy, listen, I'm just taking your blood pressure. I'm a bit concerned. It's very high. You need to take these blood pressure tablets, right? Because, if your blood pressure gets too high, you're going to have a stroke or whatever it is. And you just take it and say, yes, geez, I don't want to have a stroke. Okay. And you stay on these things for months, years. It's a normal thing. My father was on it, so I'm on it. You rationalize it like that. Instead of thinking, this is the most amazing body organism in the whole world. It is a self-regulating organism. It is able to maintain homeostasis and balance, right? Okay, I've got this blood pressure problem. It's not balancing out. what's happening. Do I have a blood pressure medication deficiency? No, I don't. Okay. There's something else going on. Is it a stress? Am I not sleeping? Have I got a nutritional deficiency? What is that there? I'm not prepared to take those blood pressure medications for the rest of my life. Besides it having side effects, it is now suppressing my body's vitality. And then we get that example that I gave you. I'm just a bit under the weather. And I'm 60. That's the reason. That's not the reason. Your body's defense mechanism or vital force is programmed to give you vitality throughout your life if you protect and use this body as it should be used. So you can't overwork. You have to eat good foods. The GMO foods that we're putting into our bodies, okay? Terrible. The plastics, the xenoestrogens, these are all external or environmental toxins that are affecting this body. So that's why you might need a detox, so to speak. So we're looking at preserving the emotional integrity and the physical integrity. And in this way, you're going to maintain your vitality. And I can be 80 and I can be as sharp as a pin, all right? Not getting Alzheimer's. And that could be a norm, right? But what have I done? I haven't abused my body throughout my life. Yes, there'll be periods where you work too hard. Then you're going to take a holiday. You're going to get enough sun. You're not going to be using too much EMF exposure to the blue light from your screens. It's about balance. But I find that people are they're not so into that. And they don't actually take responsibility for their lives.
It's almost like, it's a constant battle against what's become societal norms, really. And it's because it's so normal and commonplace to do these things, to take the easy way out. And because it's so in our faces, it just becomes, well, why would I try anything else when this works? But then I always look at the other side of the coin. And, part of the reason why I got into holistic health is all of these things that are not, that are kind of masking or putting a Band-Aid on by taking, say, for example, the blood pressure medications or the thyroid medications. They cause other symptoms. And so you don't actually always feel better. You may, stop gaining weight all the time, or you may have a little bit more energy or feel less depressed, but all of a sudden you've got another basket of symptoms. And it's almost like choosing which symptoms I'm willing to tolerate more. And I guess it goes back as well to, do you want to feel depressed or have eczema? Which we're picking from what we as individuals can tolerate, as opposed to being healthy and not having any symptoms.
I think people, they haven't been trained to actually believe that I can have a healthy body and I don't have to have symptoms. It's like a norm.
Yeah.
Okay, I've reached 40, I'm going to have this ache and this pain in my back. And we need to educate the people that you have a right to vital health, and it's changing the perceptions. That's what is so important.
Yeah.
I want to take it a bit further, because this is something that is very unusual and not many people have experienced it. Even if you have come over the fence and you are using homeopathy, there's different ways that you can use homeopathy. You can use homeopathy from a first aid perspective. The most simple and well-known remedy is arnica for bruises. It's working on the physical body. And when we get into the more subtle and the deeper aspects of homeopathy, where you're working on this emotional body, it's actually quite difficult to get the symptoms out of the patient, right? They're not going to tell you, I'm just so pissed off and angry and I've been like that for 20 years. So you are trained when you do the homeopathic courses to understand the symptoms that relate to. And the remedies work like you would see ailments from jealousy, ailments from suppressed anger. So you find out, you can either ask them directly, they don't always tell you directly. Let me give you an example. Often there's a lot of grief, right? No, they'll come in, they say, I haven't been well for the last 5 years. When you find out what happened 5 years ago, no, I lost my father and it's actually affected me really badly. I think about it every day, or something to that matter, right? Then you give the homeopathic remedy for grief. And then about 2-3 months, when they're in front of you again, you say, tell me more about your father. He passed 5 years ago. Are you still struggling with it? Sit there, think. No, actually, to tell you the truth, I'm actually doing quite well. I'm not thinking about him all the time, and I'm not getting emotional all the time. It's something like as subtle as that. But you know what that does? That frees up a lot of the body's resources to be able to go and perform homeostasis on other organs and other systems. Because before, they were using all their energy to just try and process this grief that their body was not willing or able to release. So that's how it goes. And there's, again, different layers. And it's so amazing when you get to that top layer and just allow the body to spend the energy and the healing and increase the resources where it needs to. People turn around 180 degrees.
Yeah.
Then you get the benefits that kick back into the physical body. And they say, well, all my arthritis is gone, or my energy is back. I'm able to get up at 6 in the morning. I wasn't able to do that for 20 years. Things like this start to happen. And it's called regressive vicariation. The body's healing backwards. People aren't aware of it. They are very familiar with, oh, I've got a headache. Give me that pill and I'll take the headache away. So a lot of education is needed. But let me tell you, the results are phenomenal. It's not, as you used the word previously, it's not a Band-Aid. It's not a process where, like I've got a headache and in 15 minutes after taking the pill, the headache's gone. Sometimes you can get that, but those are more acute situations. Right? When we're talking about chronic disease, we're talking about disease where the body's resources and energy has been blocked or switched off due to some type of trauma, metabolic problem, right? Homeopathy is also very good for detoxification. So in today's world, we are surrounded by toxins left, right, and center, whether it be the plastics, whether it be the glyphosates, whether it be the xenoestrogens from the hormones, whatever it is, right? Homeopathy's got a wonderful answer to that. It's called an isotherapy, where you take the toxin. Let's use a heavy metal, all right? A heavy metal that is locked into the body and is causing those symptoms. Let's say, for example, mercury. You take homeopathic mercury and you feed it to that patient, and it kind of facilitates the body to be able to release the mercury. That can be done the same for the contraceptive pill. And what a lot of women don't realize is when you ask them, are you on the pill? I was, but that was 20 years back. I haven't been on the pill for 20 years. Well, can you believe it? It can still be affecting you. Okay.
Wow.
It changes the endocrine feedback mechanisms. By giving a homeopathic potency of this contraceptive pill, it releases that out the liver. So the liver metabolizing estrogen can be restored. And you can use this across the board from, like I said, contraception to a toxicity that you picked up from plastic or glyphosate, whatever it is. It's non-toxic, it's not expensive, and it's very effective. One of the things that I use the most these days is antibiotics. Antibiotics is handed out like Smarties to patients, right? And it plays havoc with the gut microbiome, decimates the gut microbiome, your diversity. Using a homeopathic potency of an antibiotic, you can restore that much more quickly. You can get the diversity back. Amazing. It's not expensive.
You mentioned, the antibiotics thing. I had a little chuckle to myself when you said that, because I know quite a few people who have no medical background. They're just, your average individual who's trying to look after their health the best way they can. And they go into the doctor's office and ask for antibiotics. Say, I'm not feeling well today. I need antibiotics. And they will be prescribed antibiotics without actually, they don't really know if they need antibiotics at that point. There's been nothing done. They haven't said their symptoms. They've literally walked into the doctor's office and asked for antibiotics and walked out with it. And that was the extent of the consult.
That is true. And I think they've been taught that way, When else does a doctor in general prescribe antibiotics? So that's what they're going to get. And the other shocking thing is, and I'm not disputing that it helps, and it can help really quickly. Okay. So those scary symptoms, or maybe high fever or diarrhea, it resolves quite nicely and quite quickly. but the decimation in the wake of the antibiotic is shocking. And unfortunately, the patient doesn't link that to the antibiotic that they took. Even 5 years down the line, when their child is in school and they're suffering with ADHD and behavioral problems, they don't link it to all the antibiotics that the children were fed. They just link it to the immediate action when they had the flu, they needed the antibiotic.
Mm-hmm.
There's so many different ways to shadows. There's many ways to skin a cat, right?
Yes.
And it's all about education. And that's going to be the difficult part because people are set in their ways so much.
And just don't know anything else, And again, going back to what we mentioned about it's the last resort sometimes. It's until you start researching and getting in there on Google and looking at what else can I do because something, XYZ hasn't helped. It's just about education and general knowledge about where can I go to get help for these things that isn't just, again, the Band-Aid approach.
Right. And so the other thing that I think is really great is, go back and we talk about that mental and that emotional body. When do people really start taking responsibility for themselves or their lives or their situations? When the power is in their hands. So if they have got an illness or condition and they've tried all the norms and it's not working, they start searching outside the box. Okay.
Mm.
And that's when they start to heal. So as frustrating as it can be for us as practitioners, that, like you said, it's the last resort. When you get a person coming in, they are very powerful in your hands and they will do what you tell them to do, even if it's very unusual or very foreign to them. Because now they're desperate. They're at a stage where they've done the norm, they've done what they were brought up using, and it's not working.
Yeah.
So that can be very rewarding also.
I hear what you're saying, and I want to touch on the old age thing. I find myself saying it every now and again. Oh, my body's not the same as it was. I'm not bouncing back like I did when I was 20. And I have to approach my health differently. I have to approach workouts differently. My body needs different things, but it's being conscious and recognizing that. And I see so many people who are 60 and 70 and just have resigned themselves to the fact that, well, I cannot do that anymore.
Yes.
I can't go for a lengthy walk. I can't play with my grandkids. And I guess what I'm getting at is I want to get your input on, or, your experience with changing someone at that age, changing their mindset. I know some of it is they become desperate and to a point where, no, I don't want to feel this way anymore. But what do you do when you get a lot of resistance? Or maybe it's that when people finally come see you, there no longer is the resistance. But when you see people in the general public who are, no, I'm just old, and it's frustrating. And I want to know your kind of input and thoughts on that.
Yeah. So, you've got different types of people. You've got the guy who you're not going to change him. He's for 40 years, he's had that mindset. And listen, how did you put it? I can't do those walks anymore. Okay. So he's quite inflexible. Now, remember what I spoke to you when we spoke about palliation and suppression? If we look at that mindset, not being judgmental in any way, if you look at that mindset, no, listen, I just cannot do it anymore. Okay. I can't go for those long walks. I can't play with my grandchildren, whatever you're saying. That is a stubborn mindset. He's not pliable. He's not able to be flexible and look for the ways around it to achieve what he's wanting to say, be happy and be at peace and joyful with his grandchildren. That is a sign often of the suppression and this palliation. So again, it doesn't come from today or yesterday. It comes from 10 years ago when he was on that blood pressure medication, or he's been taking the antidepressant for 10 years. That's forms and causes that suppression on that level. So that's a one-time person, and you're probably not going to change them. And if they wanted to be changed, it would take a lot of energy and a lot of time to see change here. And most people will be like, no, I can't do it. Then you get the other person who, too much work. Okay. Then you get the other person who's like so determined they've got some physical problem, like, my knee just locks, or I've got that arthritis or that pain, but they are willing to put the work in. That combined with the homeopathy and whatever other modality you're going to use, whether it would be sauna, whether it would be exercise, whether it would be physio, okay, their mindset is, I'm going to get this. I'm going to beat this. Okay?
Yeah.
The results are brilliant. So
Yeah, of course.
it's not a foregone conclusion that everyone's going to come right. You are a model of what you've done before. So if 10 years I've just been blasting my body with suppression, I'm going to reap those rewards. How does it go? What you sow, you reap. So remember,
Absolutely.
we spoke about these natural laws. You can't get around that. You might cheat it for a little bit. You might cheat the system for a little bit, but it'll always catch up. All right. So there is a lot of good possibilities for people who are open to change. But like we said, it's going to take a bit of work. Okay. So I'm a bit stiff. You're going to start doing things like sauna. You're going to start doing things like getting them to move. There's lots of studies being done on the use of oxygen. You get enough oxygen into the body, get rid of that oxidative stress, you literally turn back the clock for those people. But if you have a look, I think we are supposed to be outside in the environment 85% of the time. We're down to about 2-3%. You've got to give your body, this natural body, you've got to give it the resources, the stimulants that it thrives on. It needs the sunlight. Often there's people who are in weather where it's too cold or whatever the situation is, they don't see the sun. They get depressed, they get down. Okay. The body cannot function there. So you have to give it what it needs. Is it going to be easy every time? No. But how important is it to you? I mean, again, I'm going to be a bit dramatic here. I'm just assuming that you've got children. If you've got children, I'm going to say to you, listen, your boy finds you and says, Mommy, I'm not coping. I'm so scared. You need to come home right now. And he's crying. Are you going to say, no, I'm calling from home? That's your boy. You're going to turn this podcast off and you're going to head home because there's problems. So you've got to follow your heart. You have to. Your body will never lie to you. You're going to follow that heart. You're going to follow what you need to do. So if it is a priority for you, you will do it. If you've had the suppression and the palliation in your life, you'll know where that's a priority because your mind is so blocked. You see all these people today with Alzheimer's, dementia, that's all suppression. And it's seen as a norm. That is something that occurred because of your body not being able to process as it would need to be, exposed to the right light, exposed to the right rest, exposed to the right food, not taking in the toxins. You have to follow nature's laws. We are nature beings. We are biological beings. So it's as easy as that. We can go and talk further on the emotional aspect. That's things that maybe some people are not aware of. But the emotions drive so many aspects in your body, how you think, how you process things. That's where I would say 70% of the work that I do is dealing on the emotional level, freeing the people up from those emotional ones that they are, let's say I was sitting here and I had these thoughts rushing through my head that were stopping me from actually being present in this podcast. That's not serving me. But why is that happening? Why have I got these repetitive thoughts going on? What has happened previously in my life that has led to this? So sometimes you can give maybe a vitamin D, a B3 or something like that to fix the methylation problems. But the homeopathic medicine works wonderfully well to change the emotional pattern that has led to.
And that's hard work itself. You don't want to feel badly. You don't want to feel angry or sad. Like, as you mentioned earlier, when people ask, we're trained to say, yeah, fine, thanks, and carry on. Instead of looking at your friend who's asking you and say, are you just asking because this is a societal norm or do you want the truth?
Yes.
Are you open to
Yes.
a conversation about how I'm having a bad day today? And it's the suppression of these emotions, as you're mentioning. And I want to kind of acknowledge to all the listeners out there that it can be really overwhelming to think about acknowledging your emotions and letting yourself feel them in order to get healthier, to move past it, to work through it. And so while this can be an overwhelming process or a difficult journey, it's not necessarily going to happen overnight, but the reward at the end is that you're no longer suffering and it stops becoming so difficult because then all of a sudden you've got this, new toolbox. Your
Yes.
life has improved, your health or your emotions, you're able to manage or the symptoms are gone. And so it stops being really challenging and difficult and overwhelming and becoming the norm for your life.
Yes, absolutely. That's what drives me. The thrill to see you've worked with this patient for however long and then that they walk out a fuller person. That just does
Yeah.
it for me. And to bring another example of what you said, I think this is the barrier to entry. People are overwhelmed by, like you said, am I going to have to talk about all my angers or frustrations or how am I going to deal with it? When that comes up, I feel totally helpless or overwhelmed or whatever it is. So this is how we approach it. It's not that you have to spill your guts on the table and have all these detrimental or painful experiences. This is one of the beauties of homeopathy. I don't have to know about all your traumas. I just need to know certain triggers, and the homeopathic remedy helps to bring it out. But here is the difficulty. It's like there's a disconnect in the patient's head where you'll say, listen, we're going to be talking about emotional things. They immediately go to the trauma and everything coming up. So you've got to be able to bring it home to them that it's not going to be stressful to do this. It's just gentle. And after a year, we'll be doing a marathon.
Step by step, right? To get where you need to go. What is it?
Yes,
Slow and steady wins the race.
that's it. But I just want to tell people that it so is possible.
Absolutely, it is. There's a lot of hope. There are loads of people sharing these stories to just encourage others to do the same because the changes are remarkable and you just live this longer, more fulfilling life. Who doesn't want that? Dr. DePontes, how can people get in touch with you?
We've got an Instagram page and they can email me at anthony@drdepontes.co.za.
Perfect. And do you have a website?
Yes, it's www.drdepontes.co.za.
All right. So I'm going to link all of those in the show notes so that anyone who would like to check out Dr. DePontes, the work he does, get in touch.
Yes.
Thank you so much for joining me today, Dr. DePontes. It has been an absolute pleasure.
Thank you so much, Ellie.
Thanks for joining me on the Holistic Health Show. If you enjoyed the episode, subscribe now and get ready to embark on an incredible journey toward holistic wellness. Until next time, be well and stay holistic.